Thank you for joining me here at the live desk. I am Janae Hancock. We have an alarming report here in the KCTV 5 newsroom. You saw it there on your screen. The state of Missouri has kicked more than 53,000 kids off of Medicaid just in the last 4 months. And with all of that being said, I did want to bring in an expert to explain why this is and what parents can do moving forward. And so you're taking a look at Caitlin Whaley. She is the communications director at the Missouri Department of Social Services. And Caitlin, I want to thank you so much for joining me here at the live desk. Such last minute, but I do appreciate it. I think the main question is right now, why is this?
Sure. So thanks for the opportunity to kind of explain what's going on today. So the state of Missouri and states across the country have been working to what we call unwind some changes that were put in place during COVID, during the federal public health emergency. So at the beginning of 2020, the federal government asked states to pause annual redeterminations of Medicaid eligibility. So these are yearly determinations that states conduct to evaluate whether or not people enrolled in their programs are still eligible. So it's regular course of business. So those were paused at the beginning of 2020, and all the states across the country resumed those annual redeterminations in the spring of 2023. So really, the state is just resuming that regular course of business and working to evaluate whether individuals who have had their eligibility paused and were received, that couple of years of continuous coverage are still eligible for the eligibility for the Medicaid program here in Missouri. And Missouri has actually really increased the number of redeterminations we've been able to do without asking for folks to return paperwork to us. So prior to the pandemic, we were only able to do about 10% of our eligibility renewals without asking people to mail stuff back to us through our electronic data matching. And we've actually increased that to nearly 45%. But for other individuals, that we're not able to data match electronically, we do mail out redetermination and or renewal forms that we ask people to look at, correct any information, and then mail back. And that is a required part of maintaining Medicaid coverage.
And so is there a lack in that area as far as people returning that back to you guys? What are we seeing there?
Sure. So the largest reason that we see overall for people losing coverage is that we didn't get that form back. But with the amount of time that we went between evaluating eligibility, a lot of folks' circumstances may have changed. So in some part of it is education, just letting people who maybe applied during the pandemic and don't know about the annual renewal process, educating them that they do need to return those forms back to us. But then part of it might be that if a family applied when they lost their job during the pandemic and their circumstances have changed, there's really not a reason for them to return the form back to us. So a portion of those are folks who just don't need the coverage anymore, or maybe don't want the coverage, and then they just don't need to return the form back to us.
And for the children whose their circumstances, they have not changed just yet, but you have not received the forms, what kind of impact does the loss of Medicaid, what does that do to the children?
Sure. So, we always want to see as minimal coverage disruption as possible for children, but their parents' circumstances might change. So while, that child might be receiving coverage through an employer-sponsored plan through their parents, and so we do want to see as little disruption in coverage as possible. And actually in January, Missouri and other states will be implementing continuous coverage for children, meaning that once you've done that annual redetermination, that child will have coverage for 12 months, regardless of if circumstances in the household change and the household income goes up. But if a child or anyone has lost coverage because they haven't returned the form, they do have a 90-day reconsideration period where they can just return their annual renewal form to the state. And as long as they're still eligible for the program, we will go back and cover them to that date where they lost coverage, to try and minimize any potential exposure someone might have to pay medical bills. And then even beyond that, you can come and apply for Medicaid coverage really at any time. There's no required annual renewal period for Medicaid. So when you come in and apply, many of our eligibility groups can elect for the state to explore prior quarter coverage, which means they just ask that the state will look at the 3 months prior to their date of application. And if we find that they were eligible during those 3 months prior, then we will be able to go back and cover those months, whatever medical care they might have received. So, we really try and implement as many safeguards as possible for families who are in the income eligibility group for the Medicaid program to try and provide coverage for as much time as possible.
And I do want to bring our attention back to that number of 53,000, more than 53,000 kids in the state of Missouri currently without health care coverage. And how does that compare to other states as of right now?
So it's really hard to compare one state to another. Many states aren't publishing data regarding specific eligibility groups like children. Also, states started this process at different points in time. So there might be more months or fewer, or really only more months because we started the last month you could. Then other states have decided that they were going to pick specific populations to determine at specific times of the year. So it's really hard to find a state to compare apples to apples. I can say, Missouri has a large number of children enrolled in the Medicaid program. And so relative to the number of children, the number that are losing coverage is roughly proportionate to the percentage of our Medicaid population that children make up. Obviously, we are very interested in kids maintaining coverage when they're eligible. So really trying to focus outreach efforts on parents and educating them about how to keep coverage for their children.
So regardless of how you kind of look at this, either way, I know you guys said you have that 90-day period after you lose your Medicare, but I also want to just touch on just someone seeing this headline, 53,000 kids. How does that make you feel in the Department of Social Services? You're caring for these children, you're caring for these families. How does that make you feel, Caitlin?
I mean, honestly, I think it's something to keep an eye on, and we're in constant communication with stakeholder groups that work in this area very rigorously to promote coverage for children. But Missouri has done unprecedented outreach efforts with this annual renewal. Resuming these annual renewals, we've been doing more outreach than we've ever done in the past for an initiative such as this. We've been trying our best to educate folks, but ultimately at the end of the day, we do need that communication from parents and from folks where we cannot redetermine their eligibility electronically. They do have to communicate with us. So it's something for me as communication director to constantly be watching for opportunities to further spread the message. But at the end of the day, we are really working hard, taking as many flexibilities as we possibly can from the federal government to try and open avenues for people to contact us. But there's always more that we can do.
You touch on a great point there that it all comes down to communication. And I know that's what you all are urging of so many residents in the state of Missouri. Caitlin, before I let you go, is there anything else that you would like to add on to this interview?
Yeah, I just, I think one thing I'll mention is an area that's really challenging for us, specifically for electronic verification, is folks who do gig work. So if you drive for Uber or if you're self-employed, those are folks that we have challenges doing that electronic verification. So certainly encouraging anybody that feels like that applies to them to make sure that we have a good address for them on file and that they're paying attention to their mail. And then just a general note that there are a lot of different ways that someone can complete their annual renewal. They can do it by creating an account on our new benefits portal. You can visit mydss.mo .gov/renew, and you can learn all about our annual renewal process, including how to create an account in our benefit portal. You can also learn about other ways to complete your annual renewal, such as by phone, by visiting an office, or by mail. So, really just strongly encouraging everyone to keep an eye out for any communication from the Department of Social Services and make sure that, they're returning that.
Perfect. Thank you so much, Caitlin, for joining me here at the live desk. If you joined this interview a little bit late, no worries. It'll be living on our social media platforms. And then also we'll have more, especially we'll be hearing from a Kansas expert coming up during our 3:30 newscast. So look ahead to that. Right now, we're going to looking at this live shot overlooking Kansas City right now.